Hey guys, so I wanted to hop on here and do a video showing you guys what I keep in my psych clinical bag, and I have it right here. I am down back at school, and that's kind of why the setting has changed, and I realized that this might not be great lighting. However, I do live technically in a basement, so we don't really have that much light down here, but I'm going to try my best to maybe try and improve the lighting a little bit while editing. So just wanted to throw that out there. I am halfway through my third week of my second semester of nursing school. So I am busy and I have all of my kind of pharmacology stuff around the computer here because I was studying a little bit before I turned my computer on. And so it's been busy, but I was able to find a little bit of time to show you guys what I keep in my psych clinical bag. Really nothing surprising in here. I'm sure you can research it online and see what other nurses or nursing students keep in their bag. There's nothing groundbreaking in my bag, but just wanted to show you guys it and show you guys what I keep in it. So I do have just this black bag. This is the front. It has my school name on the front, and I guess you could really find out if you wanted to. However, I kind of want to keep that a little bit private right now, where I'm going to school. So yeah, I just don't really want to show it. But this is my bag that I got, and let's jump in here. So I have just a folder that I keep just papers. Our clinical instructor, she prints out journals for us and for us to read. So I like to keep them in here. I have my simulation information in here as well. So I just find this really handy, and it was, I think, like 25 cents from Target. So nice and cheap, which is always good. I have just a pack of pens. These are my favorite pens. They're the Pilot G2 0.7 millimeter fine black ink pen. That's kind of what they look like. These are my favorite pens. I have them in a bunch of different colors. And yeah, so I just have the black ones just for clinical, and it's nice to have three. So if one of your classmates forgets a pen, you can just let them borrow it and make sure you get it back at the end of clinical, because plenty of people try and steal it and you will never see it again, and you will miss it, I promise. I have my drug guide. As I mentioned earlier, I am currently in pharmacology, so we are starting to learn a bunch of different medications, and for psych, there's a bunch of different classes of medications. Like you have your anti-anxiety, antidepressants, antipsychotics, CNS stimulants, all that kind of stuff. So when I look through my patient's chart and see what kind of medication he or she is on, I like to look it up in the drug reference guide just to kind of give me a good understanding of the drug and all the other information that I need to know, like dosing, drug-drug interactions, mechanism of action, pharmacokinetics, all that good stuff. So I keep that in my bag. It is heavy, but sorry, won't kill me. I keep an umbrella because I think it was raining the one day as I was walking to school, and I needed an umbrella. Okay, that's very exciting. I have just a little change purse. So I have two of these. This one I keep in my clinical bag that I take in the hospital with me, and then the other one I take in my book bag when I go to like class. And I do that because I don't really want to be using the same stuff that I take into the hospital with me at school. So that's kind of the theory behind these pens as well, is that these are at the hospital. Sometimes I have to put them on tables, patient side tables, anything like that. And I just, like, when I sit in class and stuff, sometimes I have my pen like right by my face and my mouth, and it's just kind of really gross if you think about it. So I kind of try and keep clinical stuff and hospital stuff very separate then. school stuff. So that is that. So I just switch them out, put like my cards and my cash in a different little change purse and take that one to the hospital. So I have this little change purse thing that says smart people always make sense. And I just keep gum. I have Advil and then just like chapstick in here. A lot of times I take my chapstick out and I keep it in my little scrub pocket because I'm just always, my lips are always very dry. So a lot of times I take it out of here, but gum and mints and stuff I always like to keep in that little bag. I have this bag which has a bunch of stuff in it. So I have my stethoscope, which has caused a lot of buzz the past maybe 2 days over when the Miss America pageant, the nurse came out and she did her monologue about her patient, and there was some very not so nice comments from the women of the View and caused a lot of buzz. But any nurse can attest, you don't need to be a nurse to know this. You don't even really need to be a nursing student to know this, but nurses use their stethoscopes. Nurses assess and are responsible for auscultating lungs, heart sounds, bowel sounds. So we use these in school, and then obviously in practice, you need a stethoscope. It's not just a doctor's medical tool, it's a nurse's medical tool as well. So I have that in there. Get off my little soapbox here. I have these bandage scissors, just have them in case I need them. I have some hand lotion, and I really love this stuff. This is the Aveeno Skin Strengthening Hand Cream, and it smells really good. So I have a little bottle of that. And then I just have like playing cards, and especially on the psych floor, I find that we do, and as a student, I think most importantly, we have a lot of downtime. So I bring in cards. These actually haven't been opened, but we have the Uno cards, and it just kind of passes time. And I think we build a little bit of a relationship when we are interacting with them, and I think cards are just fun to play. You can play a lot of different games with them. So I have them in case anybody wants to play cards. And then my two front pockets, I don't really know what's in here. This is a little bag. I have my little notebook that I carry around with me, and in case I need to quick jot down vital signs or just need to quick jot down something, I just open up my little book and I use that, and that just fits right in my scrub pocket. I have this Psych Notes little pocket guide thing. I haven't used this yet, but I think that it's good to have just in case. And then my last little pocket, oh Nellies, okay, I have hand sanitizer, my mom's favorite hand sanitizer. She sent me, like, not even kidding, 15 bottles of that. She's a little nuts, but she's a mom. She just wants to make sure I stay clean. I have a whole boatload of these like alcohol wipes. You will see if you are going into nursing school or going into the nursing profession that you absolutely need them, and I find myself like at the end of the night with loads and loads of those in my little scrap pockets. And then I have just a little first aid kit because you never know. So it has band-aids and cleansing wipes and all that good stuff. So that is all that is in my clinical bag. I think for psych, we're definitely not practicing a lot of medical skills, and it's definitely more therapeutic skills and definitely more of improving your communication skills in psych. Obviously, as nurses, they're responsible for giving the patients their meds, but it's definitely more of a therapeutic environment and a place where people can heal, but not in a physical manner, heal mentally. So I really love that floor. I guess I can give you like a really brief description of my experience so far. It's been amazing. I absolutely love it. I was a little scared in the beginning to enter the unit. I think that there's so many stereotypes out there surrounding people with mental illness, and a lot of very negative stereotypes. So I I was one of those people who believed them, and I was so scared and nervous to start on that unit. Even though I have a psych degree, I was nervous. But I am 3 weeks into it, and I absolutely love it. I think that I kind of forgot that these people on the units, they're humans and they're not monsters. And I think that society has stigmatized people with mental illnesses as monsters, and it's absolutely, absolutely not the case. They are no different than people with a physical illness. Mental illness is just as deadly and pathological as any type of physical illness. So I think that's really something to keep in mind, and something that I definitely learned being on this unit, and I absolutely love it, and I kind of don't want it to end, and I always look forward to going into the unit every time I go. So yeah, I'm loving it so far. Anyway, I think that is it for this video. I hope you guys enjoyed it and maybe got some useful tips on what to carry in your clinical bag. Probably not, but yeah, I hope you guys enjoyed it, and I'll talk to you guys later. Bye!